Hi, guys, it's Dr. Sadaf, and I would love for you to like and share this podcast and make sure you leave me a review. I'd love those 5 stars. So please, when you send me a review, please make sure to put the 5 stars in and to share the episode with somebody that you know that could really use it. And I would absolutely appreciate it. Also, if you're looking to schedule an appointment with me, make sure you go to my email and put your name on the email list. You will be the first to know when I open up my office in spring of 2024. It's drsadaf.com. And last but definitely not the least, September 16th to the 23rd, 2024, I will be hosting a retreat with Dr. Basma Faris in Morocco. You will be getting yoga and coaching, and we'll be doing excursions and cooking and spa and hammam and all of that great stuff along with meditation. So make sure you don't miss out. Spots are limited. So go to the link in my bio in both Instagram and TikTok to make sure you register. Enjoy the show. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and this episode is everything you need to know about the postpartum period, and we're going to get all into the details. But before we get into it, the one thing that actually a couple of things that I want to go over is that we are definitely not giving any type of medical advice. So if you have any questions about your health, please speak with your friendly healthcare provider. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So welcome. I am so excited to have with me Dr. Toya Luces-Sampson. Dr. Toya, please introduce yourself to the viewers and the listeners out there that are so interested in what you have to say.
Yes, thank you so much for having me. It is a pleasure to be here. And like you said, I am Toya Luces-Sampson, also called Dr. Toya. I am an OBGYN by training and a physician coach for physician moms. And I went to school on the East Coast at Howard University and residency in Pennsylvania. And then I've been practicing and living in Northern California since then. And I love everything about postpartum care, and kind of revolutionizing what it means to go through this time, because I think it's time for us to improve this experience.
Absolutely, 100%. Gosh, we all know as busy OBGYNs who have been in clinical practice that definitely the postpartum period is so neglected, right? There's so many things happening in a woman's body after postpartum, after she delivers, with the hormones going down and the breastfeeding and, painful sex and all this stuff. And who talks about it? No one talks about it. And your gynecologist doesn't have time. So tell me, how do you approach this, what we call the fourth trimester?
Yeah, so I really try to separate it actually, because when people say, postpartum, they're thinking about the fourth trimester, which is great. I love that as a society and definitely as OBGYNs, we are focusing more on the fourth trimester. And for those who don't know, that's the first 12 weeks after you have the baby. My passion is really past that because I feel like
Mm,
it's an even more forgotten time,
yeah.
that people just assume that you're no longer postpartum when, medically and really personally and everything, you are postpartum up until a year. So I still call myself postpartum because,
Mm.
just so you know, my daughter will be 1 in 1 week at
Woo!
the time of this recording.
Nice.
So,
Congratulations.
it's this entire year of changes, and there's certain things, even physically, that still have not recovered from the fact that you were recently pregnant and just gave birth. There are
Yeah.
things that may still be affecting your life from this event that happened. And I think that once we talk about it and change the way that we think about postpartum in general, and yes, the fourth trimester is very important, but not forgetting the rest of it, then we can start talking about the issues that women have in this time, like painful sex and mental health issues and things like that.
Yes, absolutely, absolutely. And in fact, I think like ACOG says that one of the biggest risk factors in the postpartum period is maternal suicide. Right?
Yes.
I mean,
And that
gosh,
peaks,
that's and
yeah, just
and
that peaks at like 6 to 9 months,
yeah,
right? And you wouldn't think that, but
and
when
no
you
one
think,
talks about that.
yeah, when you think about it, when I heard that statistic, I was very shocked. But in the fourth trimester, when you just had the baby, there tends to be more support, even though the newborn phase is challenging.
Yeah.
It's still, the baby can only do so much, right?
Yes.
You still have a baby when it's further along, but now the baby can walk around. It's a little bit more challenging because they're mobile and all of those things. You don't have as much support. And then you have to go back to work. You have to start reintegrating into normal society. And people expect you to like bounce back. And if you were not feeling well mentally in the first 12 weeks, a lot of people say, well, let me just give it some time. Let me give it some time.
Yeah,
And then as the months go along, you realize, well, I still don't feel well.
exactly.
And you have had months of untreated depression or whatever other issues. So when you think about it in that way, it's not surprising, but it is really shocking.
Yes, absolutely. I
Yeah.
think like last year around in I don't know, I would say probably yeah, exactly a year ago there was a story here in this area where I live and it was a physician. It was a physician mom that had recently had a baby. I think her baby was only like 5, 6 months of age and she killed herself and her baby. It was
Yeah.
awful, awful, awful.
I remember
That
that story. I think she had postpartum psychosis.
yeah,
And yeah, that's definitely one that's not talked about enough.
right.
And yeah, I remember that being very, very tragic.
Yeah, yeah, and you're absolutely right, right? Like we think of like, you hear about the baby blues, you hear about postpartum depression, and nobody really talks about postpartum psychosis, which is definitely rare, right? We
Yes.
know that it doesn't happen, but when it happens, it's absolutely life-threatening, and
Yeah,
the patient needs to be hospitalized.
exactly.
Maybe you could just go over for the listeners and the viewers that may not know just the difference between postpartum blues and depression and psychosis, just so that everyone's kind of on the same page.
Yeah, and that's a good place to start because a lot of people assume that the baby blues is something that happens, and then if it doesn't go away, then it's just a worse, postpartum depression is a worse form of baby blues, and that's actually not true. Baby blues are a normal physiologic response to this major event that you just had, right?
Right.
You have a shift in hormones, you have overwhelm from the fact that you have this new baby, and the emotions are high, and that's why you may feel sad and tired and exhausted and all of those things, and the timing is what makes it different. So those feelings should only last for 2 weeks after delivery. If you're having similar symptoms or worse past 2 weeks, that's not baby blues. It's not just bad baby blues or it's getting worse. That needs to be evaluated because it could be depression or it could be something else. I think that's something that is, we kind of lump everything into, well, I had postpartum. That's what people say, right? And
Right,
meaning they had postpartum depression. But
right.
there's actually so much more than
Yes.
postpartum depression. You can have postpartum anxiety, you can have postpartum OCD, you can have postpartum psychosis. So that's why I say if past the 2 weeks you are not feeling like yourself, then you need to be evaluated because it could be any number of these things. And postpartum psychosis is a medical emergency.
Absolutely.
And, the major difference with psychosis is that for most of the other things, you are aware that the way that you're feeling is not good. And this is a very generalized explanation. With the psychosis, these thoughts that you are having seem reasonable. You may have the intrusive thoughts, but you don't think they're intrusive. Like you just like, oh yeah, that seems like probably an okay idea, and that's like the difference. And for an observer, you can tell kind of when somebody is it matches like it is a reasonable thing, as opposed to having that fear and, why do I think this way? So it's something that definitely needs to be evaluated by a professional if there
Right.
are any abnormal feelings past that 2 weeks, and not just say, oh, well, I still have the baby blues.
Right, right,
Mhm.
absolutely. And I think with postpartum psychosis, patients can also hear voices, right?
Yes.
Telling them
Yeah.
to harm themselves and harm their baby. And
Yeah.
it really is a medical emergency, and you
Yeah.
need immediate hospitalization for that. And
Yeah.
really so important for women to seek out help when they're starting to experience like even the blues, right? Just,
Yeah.
I was a few years ago, I was part of this academic institution, and there we started a postpartum depression program where it was like a telehealth where we would call the patients,
Mhm.
postpartum and make sure they were doing okay. Most recently, I did a locums, and I was at a clinic where they would actually see the patients at 2 weeks and then at 6 weeks.
Oh,
And
nice.
really, the focus was to get in early on their postpartum health in terms of really their mental health, right? So you're doing that Edinburgh Depression Scale, you're doing the PHQ-9, and really getting them the services that they need. And I was
Yeah.
really impressed because this is, a federally funded clinic. They don't have that many funds, but
Nice.
yet they are sitting there, worried about the mental health of their postpartum moms, which is more than what I saw when I was doing private practice, because we would only see the patients one time
Yeah.
unless they had a C-section, but really just one time postpartum at 6 weeks. And how long is that visit? Like 10 minutes, 15
Yeah.
minutes? Like, oh, you're doing fine. Okay, let me just do a quick check. Okay, bye. See ya. That's
Right.
it.
Yeah, and that's why so many women don't even go.
Yeah.
They think it's a waste of time. They
Yeah.
think we're just going to push birth control on them and then say bye.
Right.
And, so they just don't show up. And I think it is, it's more than that. It should be more than that. And it's interesting about federally funded health centers, because they are, they have more government control. Like when ACOG says things, they tend to implement them faster than like a private
Mm,
practice.
right, that makes
So,
sense.
with over recent years, ACOG is saying, we really need to see people a lot earlier. And I know at my old institution, for the complications, of course, like hypertensive disorders, we brought people back in within a week. C-sections got checked every 2 weeks. So we're heading in the right direction.
Right.
But definitely speaking about these things more, and about having sex, about having comfortable sex, and what it means to that mom, whether she is scared to do it, she doesn't want to get pregnant, she is just completely not thinking about it, she is turned off. All of these things I feel like we need to start speaking about, so people don't have this shame and guilt, because we have enough to be guilty about. Like, there's enough. We don't need to add on our partner's desires or our own desires to it.
Yeah, I'm so glad you bring up postpartum sex. Postpartum sex is something that like really people do not talk about at all, right? And everyone who is, female body or vulva owners really experience that, postpartum, and we just don't talk about it. I think a lot of it has to do with the discomfort of the physicians and physicians that don't know how to deal with it, because as you know, we're not taught sex
Right.
ed in med school, hardly what, like 2 hours. And then
Right.
in residency, even as OBGYNs, we don't get sexual medicine. We don't get
No.
menopausal medicine. We just don't get any of those things, which is really unfortunate because we're the ones taking care of
Right.
women and trying to help them out. And then like postpartum sex, right? Like nobody tells you, at least no one told me. And
Right.
I'm sure nobody tells a lot of people that it's going to be painful, right?
Right.
That, you have these hormonal changes. You haven't had sex in a long time, and, especially if you're breastfeeding, right, your
Yes.
hormones are down, your estrogen, your progesterone are down. There's going to be decreased lubrication. Use lube if you need lube. There's
Oh,
no
use
shame
it.
in using, right? There's no shame in lube. There's
Yeah.
no shame in talking to your doctor about painful sex, especially if you had a vaginal repair and you have
Mhm.
stitches. That may be what's uncomfortable. There's so many reasons that you may have pain with intercourse. You
Yeah.
may need a vaginal moisturizer. You may need vaginal estrogen, right, to increase that blood flow into that vulvar region. I mean, there's so many things, and nobody's taught.
Yeah.
unfortunately. And patients don't know, and then they think, there's something wrong with
There's
them.
something wrong, right? And I feel like you touched on so many important things that I just want to elaborate on.
Yeah,
For especially for people who breastfeed,
yeah,
I just told my friend who had a baby 3 weeks ago in a text message. I was like, breastfeeding is like menopause. So it's going to be dry down there, and that's fine. For both of my deliveries, I don't know, this may be TMI, but whatever. This is a Muslim sex podcast.
that's
But I
right. There's
had
no
my
TMI here.
yeah, I had my vaginal estrogen pre-ordered and,
Good
waiting for
for
me.
you. Good for
Yeah, I
you.
was not playing around with that. So
Yeah,
there should be no shame. These are
absolutely.
changes that are happening, and there's nothing wrong with you. If you choose to breastfeed, this is what is going to happen most likely. Everybody's different. So you may have some discomfort, and it's not that you need to avoid intercourse. You
Yeah,
just need to make it more comfortable. And whether that means doing moisturizers, doing the lubrication, and adding on the estrogen. All of these things are normal. And if your doctor is not comfortable speaking about it, then make them. They'll be fine. It's
exactly.
okay to have a little bit of discomfort. It's okay.
Exactly. It's growth, right? I always say there's no shame in the lube game,
Yeah,
right?
I love that.
There's no
I
shame.
love that.
So absolutely, everyone needs lube. I mean, there is
Yes.
absolutely there should be no shame in that.
Yeah.
So I'd love to hear more about like how you help women navigate through the postpartum period and all the things that you offer. I mean, I'm sure there's tons of women that are sitting here listening and going like, "Oh my God, I so need her," right? Because you just don't get that support that you
Yeah.
so badly need during this time.
Yeah. So I help physician moms who are postpartum and beyond. So I feel like a lot of the issues we talk about are very generalizable to the general public and to women who have children that are a little bit older as well, not just in that infant stage. And people are like in this fog once their kids are like 2, 3, and then once they get a little bit older, things kind of settle out. So I find a lot of my clients all have very similar issues, but the ranges are wide, like
Yeah,
3 months postpartum versus like 15 months. So that's why I include that wide of a group.
right.
And it really is the central my central message is to prioritize mom first, and then
Mm,
everything else will be okay. So
yes.
if whatever you need in this time is that you're having painful sex because you're breastfeeding, that's what we're going
Mhm,
to focus on to make sure that
right.
you are able to have good sex, and then you'll be happy, and then your baby will be happy because you are happy. So whatever the issue is, I that is where my guiding light is. How do
Mm,
I get mom to be okay, cared for, loved, and
mhm,
just mothered? I love
mhm,
that saying, we need to mother the mother,
mhm.
and everything else in the life then becomes so much better. And just making sure that we are not lost to this beautiful thing called motherhood. We
Yeah,
still want to have a piece of ourselves that is just ours and
yeah,
not giving to anyone else, whether it be partner, job, children. So
right.
I really, help women kind of structure their lives in that way so that we can get you taken care of first, and then everything else tends to fall into place afterwards.
Yeah, I love that. That's like a true gynecologist, right? Always take care of the mother first, and then everything
Exactly.
else will follow. So
Yes.
absolutely, I love that. It's always about the mom as it should be.
Always. Yep.
So, I'd love to hear what are your top 3 reasons why clients may come out and seek out your help. What are their biggest concerns?
Yeah, so there is a lot of anxiety in this time.
Mhm.
And, to be super clear, I am not doing anything medical. This is all coaching. And it's so funny. What we do in the office is so much coaching that there's there's some medicine, but a lot of it, especially in a time like postpartum, is coaching.
Yeah,
So while I don't treat people for anxiety, we kind of get to the root of this anxiety and what's going on. What changes can we make to make you less anxious? And what tools can I give you to help you? And if you do need medical care, then directing you in that way, because I do have the expertise of a board certified OBGYN. So
Mm.
there's a lot of anxiety, and there's a lot of resentment, actually. And that was kind of my
Oh,
story and how I came to
interesting.
this path. Yeah,
So
this,
funny, nobody talks about that, right?
oh,
The
there's so
resentment.
much.
Because the mom is always supposed to be, like, so happy and so
Yep.
grateful and, and which, of course, is the case,
Yeah.
but yeah, I love that you bring that up because that is often I don't think I've ever heard anyone talk about that, and I'm glad you bring it up because it's true, it's real, right? This is what makes a person a person. So let's delve
Yeah.
into that. Tell me about the resentment that you hear women talk about.
Yeah, so I can actually give you my story.
Oh,
So, after I had my daughter almost a year ago,
mhm.
I felt like nobody was really taking care of me the way that I should have. And
Mm,
I had her during a time where I was having a lot of pain during the pregnancy, and it only got worse afterwards.
okay,
So I was like hobbling around, but in my mind, I should have gone back to normal pretty quickly. I did this before. It's fine.
right.
So I kind of jumped back into regular life too quickly, started doing things like my advocacy work and speaking and all those things very quickly as well. So it's no wonder I felt like nobody was taking care of me like I was supposed to, because I wasn't taking care of me either.
Right.
And I also wasn't speaking about what I needed. So
Mhm.
I looked around, I saw everybody acting like everything was fine. And I secretly built up all of this resentment. Well, I'm seeing this problem. I'm obviously in pain and all these things. Why don't y'all know about it? Why aren't y'all
Mm.
reading my mind?
Right,
So
right. Yeah. Uh-huh.
I was silently stewing. And it's not like if, everybody was doing what they were supposed to do, of course, you always think you have the best way of doing everything, especially as a mom. But in my frame, you know, that's how my situation was, and nobody could tell me anything different. And it got to a point where I kind of just hit a wall, and I actually told my husband, I'm gonna take a trip. I'm gonna go by myself, and you all stay here because I just need a break. And he was like, what are you talking about? No, you're not going anywhere by yourself. So we actually ended up taking that trip together and kind of just reconnecting and talking about what was going on. And through all of that, I realized that I needed to kind of take care of myself first and set an example, and also be very open and upfront about what I needed in this time,
Mhm.
because I can't expect somebody who's never given birth to know exactly what I need. I can't expect my mother, who is 70 something, to remember what it was like, and read my mind and give me exactly what I need. I need to be clear, and I need to set those boundaries. So some of the resentment comes from people not taking care of us as we should, but oftentimes we have some responsibility in that we see things and we're like, well, if I see it, it's obvious.
Yeah,
everybody else
right. They
everybody
should
else
say
y'all
they
y'all
should
know.
know,
You
right? They
should
should
know,
know.
right? So there needs to be responsibility on both sides. And I definitely took my part of it in all of that resentment that I built up. I was angry. I was just like, fuck that, like, what, this is
Yeah,
this is dumb.
yeah,
Like, why aren't y'all doing exactly what I want you to do, even if
yeah.
I don't say it,
That's
so
right. That's
that was
right.
my story. Of course, everybody has their own story of how that kind of
Mhm.
resentment builds, but it has been a very consistent trend that I have found, even with moms who say their relationship is great or that their motherhood journey is great. There's still something where you are giving so much of yourself, and the others around you are not giving so much. So
Yeah.
it's like a jealousy almost, and that resentment. But again, taking 100% responsibility, well, if you are going to prioritize yourself, I'm going to do the same. I'm going to set
Mhm.
this boundary
Right.
and turn this resentment around. And if
Yeah.
it causes some friction, then we can work through that. But it
Yeah.
can't just be that I sit here stewing and take no action to rectify the situation. So
Yeah, I love that. I love the fact that you bring that up because that's so real, you know? And
Mhm.
I remember when I had my 3 children and, you know, especially I think the first one really just rocks your boat, right? Like you have no idea. You think like, "Oh, well, whatever. I've been up before. I'm an OB.
Yeah,
I've taken call. I've been up," you know? But
yeah,
there's no post-call in motherhood.
exactly.
None. No post-call. You can be up all night and then you're still up the whole next day. It doesn't matter.
Right.
Nobody cares. And
No,
so I think that absolutely that resentment is so easy to build up because you're so tired.
yeah,
You're exhausted, you're in pain, you know, like I remember there were days where I barely even like brushed my teeth and it was like 3 p.m. and I'm like, what the heck? I haven't even had any time to shower and my kid is still crying and I hate this, you know? And
right.
gosh, I mean, the first 3 months of motherhood for me are like a just a blur, like, they
Yep.
were just awful, and now you know, when I hear I still remember my 3rd one, when he would like, I would hear him crying when he was
Mm,
newborn and, you know, and it was time for me to nurse him, I would get like this like, I had this PTSD, and it was
yeah,
this horrible like, I just hated it,
yeah.
you know, and you hear, like, moms are like, "Oh, I just love breastfeeding." No, I hated breastfeeding, I
Oh my
hated it.
gosh, I'm so glad you said that. Two
Yeah.
things that you said that I love. One, that your third child still gave you issues. Like people think,
Oh, yeah,
oh, well, I've
yeah.
had a kid before. Everything will be fine. I can handle
No,
this. But
no.
sometimes my postpartum experience with my second was way worse than with my first. And I feel
Mm.
like having something to compare it to makes it worse because you're like, oh, it was fine this time, you
Yeah, yeah,
know?
yeah, yeah, yeah.
And
Well, miserable, yeah.
yeah, and I love that you said that you didn't enjoy breastfeeding. I feel like
Hated
it is glorified, that it's just a sweet thing and it's not gonna hurt and everybody
it.
listen.
Yeah, I know. I mean, I really admire the women that do it so effortlessly. Like, I
Yeah,
am so envious of that. I mean, I struggled with all 3 of
yeah,
them. With the first one, I think I tried to do it for like 3 months, and I was
yeah,
like, "Oh, forget this." Second one, it was like, you know, like 5 weeks or 6
yeah.
weeks, and then the third one, it was like 3 weeks, "I'm done. I just can't. I'm
3
done."
weeks is better than none, and even if it's none, it's fine. So I
Exactly.
am no judgment here, even though I did breastfeed for 22 months with
That's
one and 8
amazing.
months with the other, but it
Mm,
wasn't, you see what you even what you said though, that do it effortlessly, there was a lot of effort, and
yeah.
I just want to say that so that people know it is not this easy thing, because then you give up. If
Yeah,
it hurts in the beginning or you
yes.
can't get the latch right, you think
Yeah,
something is wrong because everybody
yeah.
says it's supposed to be easy and it's natural. Your body was meant to do this. Don't
Oh my god.
believe that shit. I hope I can curse on your
I
podcast,
know,
but
yeah, I know,
do not
exactly.
believe that.
Do not believe it. Oh my god, you're so
Yeah,
right. I mean, I had I had such a hard time. I just wasn't producing enough milk, and then, like, you know, I would be, like, guilt shamed by my family. They'd be like, "Why can't you do this? Your sisters could do it, you know, your mom could do
oh
it."
my
Like, you know,
gosh.
some people could feed a whole village with this, you know, but I could barely take you know, I couldn't feed, like, one little baby, and I was like, "Forget this. This is not for me." I'm, like,
Yeah,
super type A, so stressed out.
yeah.
Everything has to be, like, perfect, and I was like, "I can't. I
Yeah,
can't."
and that's so important. Who you're surrounded by can really determine your experience. And it
Yeah.
is unfortunate because it's usually people who didn't even breastfeed or don't know how, like, what it takes. I'm just like, be quiet, please.
Yeah.
You
Yeah.
know?
Yeah.
So
Yeah.
I'm sorry that was your experience, but
Yeah.
I definitely, lactation consultants probably hate me because I'm just like, this hurts. You'll need to stop telling people it doesn't hurt, because it's not dissuading anyone if they know that. It is
Right.
always better if you are prepared for the worst than to
Yes.
think, it's this idealized, beautiful experience, when for a
Yeah.
lot of women it is not.
Yeah, and they just know what to expect, right? And
Yeah,
it's and if it hurts, then they'll be like, "Oh, well, this is normal." I mean, like,
right,
normal, not in a like, if it's hurting, you should get it,
right,
you know, looked at and make sure that the latch is correct and stuff.
right.
It's just it's gonna be a little bit uncomfortable in the beginning, and then it just you know,
Then
it
it
does get
it gets
better.
better. Because let me
And,
tell you, for that first month or 2 of that 22 months that I breastfed, it hurt a
yeah,
lot, and
yeah.
even with my daughter, it was like it, and neither of them had latch issues.
Wow.
With my daughter especially, my anatomy had changed between kids, and her little mouth was just not big enough to get a proper latch. There
Yeah.
was no positioning that could have rectified that. It was only time and
Yeah.
her growth. And
Sure.
if I didn't know that as an OBGYN, I would have stopped. I
Yeah.
would have just said, this isn't working. I can't do this. She doesn't want it. How many times have you heard patients say that? Oh, they
Tons,
don't want it,
tons.
right? So, yeah, speaking about these things are really, really important so that we
Yeah,
can kind of normalize
yeah,
experiences that are not perfect, because
yeah,
motherhood is not perfect, right?
absolutely.
And it'd be better for everyone, including the
Amen to
babies,
that, right?
if we, knew
Yeah.
about it.
Absolutely, right? It's like a practice. It's like with
Yeah.
anything, right? And throughout your life, you just even when you become a parent, you still are like, "Oh, I don't know if what I'm doing
Yeah.
is right. I don't know. Are they going to grow up and need therapy after that? Am I like this horrible parent?"
It's
And
not
then
because you didn't breastfeed them, let me
yeah,
tell you.
that's right, that's right. And, it's just like, no, you do your best and,
Yeah.
whatever your best is and that's gonna be enough. So, you just
Yeah.
try and that's all you can do. So I'd love to hear the third thing that people come to you for and then, then we can see.
Yeah. What
So
would be the other thing
talked
is
about breastfeeding, yeah. So
issues returning to work.
yes.
Yeah, that's a
And the
big
guilt,
one.
right? Guilt.
Yes, and there are different types of the guilt too. For the majority of people, it's I don't want to leave the baby, or I
Yeah,
feel bad, going outside the home. And but there's a group of people that are guilty because they want to go back to work. And
yeah,
that's something else that people I feel like don't talk about. And there's a label of, well, you're a bad mom, or you're selfish and all of that. Either types of guilt are not healthy, and it's okay for you to feel however you feel about your return to work,
yeah,
and just making the most of it and doing what you need to do for you and for your family. If you want to go back part-time, do it. If you could
yeah,
afford it, do it. If you don't want to go back, there's nothing anti-feminist about you staying home, you know
exactly.
um and if you really love your job and you cannot wait to get back, do it, girl. Go right ahead.
Exactly.
And I don't like when women are shamed, or people who were born female are shamed for the choices that they make just because they have this ability to produce life. It does not mean that we, automatically just have to give up everything that we ever wanted. And we also don't have to conform to societal norms. Um, so yeah, there's a lot of guilt around return to work, a lot of practical issues, like how am I going to maintain my supply when I go back? I'm on call for 24 hours. What do I do? Who's going to take care of the baby? There are just so many different changes. That dynamic change is a big one, and it can be kind of difficult to navigate.
Yeah, I'm so glad you bring up so many of the things that go through a woman's head when she's returning to work. I remember when I went back to work after each one of my kids, and I would actually get more sleep at work than I would at home, and I wasn't having to take care of a little baby. And I was
Yeah.
actually happy to go back because I could have
Yep.
adult conversations, and I wasn't
Yes.
so worried about like, what am I going to feed him? What am I going to,
Yep.
I got to change him. I got to do this. And
Yeah.
it's funny you mentioned that thing about being selfish because I remember after my third one, somebody saying to me that, "Oh, you're so selfish," having three kids and then returning to work and leaving all the work for your husband. I'm like, "Are you kidding? Are you?" I'm like, "You think I enjoy being on call?" It was just it was so upsetting to me at
Also,
that
that
time.
he's a parent too.
Yeah, exactly, exactly, and I just remember feeling awful for
Oh my
somebody saying
gosh.
that to me, that I was selfish for wanting to go back to work after having 3 children. I really couldn't understand how that was being selfish. I was taking
Yeah.
care of my family, maintaining my skills, whatever, and it just didn't make sense, and so
Yeah.
I'm glad you bring that up because, I'm sure there's a lot of women that perhaps that has been said
Mhm.
to, or maybe they feel it themselves, and it's important to understand that you're not selfish.
Yeah. And you're not alone. And people who say things like that are projecting, or
Yeah.
they are jealous, or both,
Yes.
right?
Yes.
Because
Absolutely.
they couldn't pursue their dreams, or, talk to an adult. I remember that. And I actually remember that from before I even had kids. My older sister had a son, and I remember when she was on her maternity leave, she was so excited. to go back because she's like, I need another adult to talk
Yeah.
to. And I
Yeah.
didn't judge, I didn't know enough to judge her at that point, but that always stuck with me. Because it's like
Yeah.
you're just here with this baby all the time. And they're looking at you
Yeah.
and they're crying.
Yeah.
It's normal to want to speak to somebody who can speak back.
Yeah.
Um,
Exactly. Exactly.
and
And that's not being selfish.
it's not. And especially in a case where if you feel like you are failing in motherhood, which I feel like almost every mother feels like at one point, nobody is always like, yeah, I'm killing this motherhood thing. You
Yeah.
feel like you may
Nobody
not be,
said no one
doing a good
ever.
job. Yeah.
Right?
But at work, especially for women physicians, you're probably like, I'm killing this. I
Yeah.
am doing a good job. I'm taking care of my patients. I have high empathy. Like I have these surgical skills. And it's good to feel like you are doing something well,
Yeah.
especially since the rest of your life may feel like one big bumble, one after the other. So there are
Right.
lots of reasons why people could enjoy going back. And it could be a mixed bag, right? You could enjoy your time there and then miss your babies and then come home and be like, why did I come home?
I know, right?
So
Yeah.
yeah, it's a complicated time of life.
It
And
is.
that's why I think I really enjoy what I'm doing now with helping people figure this out and getting the message out because I think it is important for people who are not in this phase to understand what people in this phase are going through so they can be more compassionate and not say things like, you're being selfish for going back to work, you
Yeah,
know?
absolutely. Absolutely. No, I love it. I love everything about it. So, Dr. Toya, tell
Mhm.
us for everyone that's listening and watching and saying, wow, she is amazing. How can I get in touch with her? How can I work with her?
Yes. So everything starts on my website. It's drtoyacoaching.com. And so that's DRTOYA coaching.com. And if you are in that stage where you're going back to work, I have a little cheat sheet there with my tips about how to make it, less gut wrenching and, a little bit guilt free. So you can definitely download that, but you can reach me there and follow me on all of my socials. It's Dr. Toya Coaching on YouTube, TikTok, and Instagram.
Amazing,
Yes.
amazing. I love it. So there you have it. Well, it's been real and really intimate. And thank you to all of our listeners and viewers for tuning in. And again, this is not meant to be any type of medical advice. So please speak with your healthcare provider about any issues that you may be having. And if you're experiencing any postpartum depression or postpartum psychosis, please seek out medical attention because this is of the utmost importance. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.